policies have impacted American Indian Alaska Native youth. So Dr. Owen, are you ready to go?
I am. Thanks, Eric. Welcome, everybody. We have a quick half hour to get this work done. We'll see where we get. Actually, can you put all the folks back up? I can run through these. I'll run through these slides, and then if we could get rid of this, maybe have the slides be small and us big. I don't know if that's possible, Kathy.
Each individual can do that where
Okay.
they can slide the toolbar,
Okay.
the slides so that they're smaller.
Okay, and I can do that too, because mainly I want to see people's faces and call on folks for ideas. So when iHeart started, one of our goals, our aims, I can always get these, even though I'm in academia for 11 years, I forget aims, goals, whatever. The end point, one of the things that we want to do in raising more Native healthcare providers, or one of the problems we wanted to address was this that we don't that well, lots of problems we want to address, but we wanted to do it part with policy. So we always intended to do some policy work, and that's what this is starting to get at. It's the first time we've ever tried this on one of our conferences, so we'll see how it goes today. I already told you who I am, so I'm going to advance my slide. I'm not going to advance my slide. Can someone please advance my slide? Miigwech. Today, I'm hoping that we can I'll look at the other slides over here, develop a framework for a policy paper that outlines the impacts and solutions to government policies affecting American Indian Alaska Natives student. Next slide, please.
Did you want to share your own slides, Mary? Mary, did you want to share your own slides? I'm looking at the objectives right now from the main deck. Is that
all right? Can you see my slides?
Yes.
I think I'm sharing the slides. Yeah, I'm sharing the slides. So if you want me to stop, let me stop sharing, Mary, and then there we go. There you are. Problem statement shows.
So the objectives. Now am I going to what? Can you hear me? Boy, this session not going well here already.
Yeah, we gotcha. We can hear you.
You're good.
Okay, so the objectives, we're going to talk about some of those policies, talk about potential solutions, and then really get into the guts of making a paper, coming up with a paper. Our goal and the scope of this actual policy paper is to collaboratively, all of IHEART get together to create a document to influence policy that's out there now and create new policies that address these problems that we'll identify. The intended audience, you can see them there, administrators, both in education and healthcare, our tribal leadership, of course, state and federal policymakers, and then all other stakeholders, including our students, their families, and their communities. And here's the proposed title. All of this is proposed. We have basically a blank sheet. I'm just providing some framework for us to work from. So the proposed title, IHEART, Addressing Barriers to American Indian Alaska Native Student Academic Success. And here's the problem statement. There's a chronic shortage of American Indian Alaska Native students applying to health professional schools. We've been talking about this. We all are here because of this. Here are some of the causes that I've identified, but I'm hoping that we can work together to identify some more of the causes. These are the ones that are striking to me most recently, being from Minnesota or being in Minnesota, are the fact that our students are still dealing with the impacts of COVID-19 on their education. So many of them were having school online. All of them were doing school online, and the impact of that online schooling to our students at all ages. And now in Minnesota, with ICE here, we saw, again, another federal policy. These are all federal policies or responses to federal policies. And I'm not saying we should have done anything differently in COVID-19, but when you put one policy after another on top of things that are happening to our students, we start to see the impacts that we have seen. So with ICE, a lot of our students were offered the option of staying home to stay safe and away from these ICE agents. And that is, again, impacting their education. Our poverty levels are not improving. We have less school safety net programs as school budgets get hit. For instance, the common one here is Check and Connect, We're seeing less and less of Check and Connect in the schools, and that was a program that our students told us that they really valued. And less funding for, this has been going on for a long time as well, the centers of excellence that many of our health profession schools have had, the pathways that come with those, and mentoring support. So I'm going to go through this. Here are some of the solutions I've identified. We'll come back to that. And then, so what I'd like to do is go to this problem statement first. And Sarah, are you taking notes? Is someone taking notes for this?
I could take notes.
Thank you. And then I'm going to, can we stop sharing? Can I stop sharing and just see everybody? All right, everybody's back, right? So problem statements. In addition to these ones that we have seen, first of all, thoughts about doing this policy paper, any reason not to do it, any thoughts on doing it, anything that we're missing in this discussion so far before we go into the problems and solutions?
I see no reason not to.
Okay.
I think it's a great idea.
Okay. All right. I'm not seeing any negatives. We're moving forward. So in addition to the problems statements that you saw, and I think, can you all still see those? Can we show those? Let me put those, pop those into. All right, Sarah, you have access to those slides. Can you put those
Yeah.
problems
Would you
into
like me
the
to pop
chat?
them in the chat? Yeah.
That'd be great. Thank you. So in addition to those problem statements that I listed, or the causes that I listed, the low success rates of our students in K through 12, long-term impacts of COVID, worsening poverty, decreasing school safety net programs, and less funding for centers of excellence. Can people think of other component? Go ahead, just call them out. Go ahead, Jason.
Okay, financial barriers.
So in
Like
addition to
the
worsening poverty levels?
Yeah, personal financial barriers. Yep.
Okay, overall poverty levels, but student individual
Yeah.
financial. Okay.
But one of our med students, Buddy Myers, and I just wrote a paper on this. It's in academic medicine. Um, well, I can share that with y'all, or you can. It should be published in a couple months. So
That'd be great. So, but impacted by these worsening poverty levels in our community.
yeah, that, and it's a burden for them to take out loans. It's a burden for them to go into primary care because of decreased loan payback, or there's lots of other issues along with the coming from a community that's under-resourced.
Okay, so the longer term impacts of that and
Yeah.
their ability to serve our communities because of those impacts. Okay.
Yeah.
Mary, if you remember, we did this at World Cafe in 2018. AIP funded by United Health Foundation. I think you were there. We got into groups.
Yes, the
Uh,
reason
and
we have iHeart. Yeah.
yeah, one of the reasons was also not only financial barriers, but responsibilities to your family and your community. For example, being a caregiver for a grandmother or having to leave the reservation away from family. So that was a theme that came up. And then just the issue related to even getting past 8th grade. So our low, that might be later on in your discussion, but as far as education, having in regards to barriers to STEM careers, I think that was the other thing that came out of those discussions.
Thank you, Laura. That's the low success rates of our students in K through 12. What I really want to hit on here is the federal impacts and policies on our students. So not just the boarding schools, but current policies and how they're continuing to help impact our students, and the fact that our students can't and our community can't get our feet under us because of these policies. Kathy, I saw you raise your hand. Go ahead.
Yeah. One of the other things I would add to the list, I think also is a lack of awareness of what's out there. That's part of the problem that I've seen repeatedly. I've talked to lots of folks where even for the younger and older kids and the families, they just don't know what programs are there. And that's why I produced Minority Parent and Student Guide, to be honest. The book is because a lot of times people don't know the approach that one of the approaches or some of the approaches that might help get the students there. And then what programs are out there to help folks. But that's one comment. But the other thing is that I'm curious, how are you handling, they're even threatening sovereignty. How are you handling, do you have any connections at the higher political level to see how to approach some of this? Because some folks have been laying low because they're even starting to threaten sovereignty. I'm not saying don't do anything, but I'm just putting it out there. Do people have feedback on that?
Yeah, Kathy, we're going to address that. I mean, that's something that we're going to have to decide on as a group, whoever remains involved on this paper, on how we want to distribute it. We've thought long and hard, even with our funders. We're going to come up with the paper and then probably just put it out there for people to use on their own. We won't necessarily be moving forward with it, just have it as an informational piece from what we see as educators. I want to go to Brianna, but before I do, Brianna, I want to acknowledge this comment. A couple of comments in the chat. The limited or no role models in STEM for rural schools. I think the impact there from federal policy or lack of federal policy in making sure that our rural schools are well staffed. We don't have enough programming to get the educators out there that we need. Julie says on the note of the financial loans, the big beautiful bill creating a new loan limit on student loans. That's absolutely a deterrent to our students. Jason, I'm guessing you talked about that in your paper. Yep, thank you for that. Being first generation is considered a disadvantage. Probably most native applicants are first gen. Absolutely. Name bias, name racism, like happens on resumes. Absolutely, all of those pieces. So the structural racism that is there. Thank you for those. Go ahead, Brianna.
Yeah, and I don't know the exact policy for this, but I'm thinking about what the Department of Education and them deciding which degrees are funded, accredited, valid anymore. And as we've been talking all week, and IHEART is expanding to these other programs that are potentially not going to be valid anymore, like public health and different types of therapy and nursing, right? A bunch of fields that as Native students we're interested in going into. Yeah.
That's a really good point. And we haven't even seen the end of it, right? We're only 2 years in. We don't know what other programs are going to be hit. And even when those programs are reinstated, there are still long-term effects on those programs. So thank you for that, Brianna. You're absolutely right. I can think, though, also, you make me think about the Indian Health Service itself and it's limiting its scholarships to folks who are going into primary care for the most part, and how that's always impacted us. Although that's at once they've gotten into the health profession schools, and we're talking about pre-health professions, what's limiting our kids from getting into that level in the first place. Benjamin mentions privatization of public education system. Absolutely, what we're seeing, and part of that is the transfer of department or the attack on the Department of Education altogether, and what that's going to do. For those of you who don't know, Department of Education was created in the 1970s to address our population as one of many groups that live in poverty and can't access education the same way, or have higher rates of poverty and can't access school same way. So thank you for that. I see Laura, you have your hand up. Go ahead. Or I thought you did.
Yes. Yeah, no, I was going to say, well, and I don't know again the exact policies, but how there is this discouragement that's backed up by decreasing funding or eliminating funding for, the race-based funding. And so then that that does a ripple effect, but definitely for, and this may hit the K through 12, but hitting, higher education, because then you don't have those pots of funding, and you can't generate grants, and they're doing away with the grants. But when there are some that you might be able to, it's so difficult, and then the universities and everybody else don't want to touch it, and so that just that erodes away the small fundings that was there in the first place. And so you have less availability to hire the faculty, the professors, the teachers, but also then it goes out for scholarships and those types of things. So
No, you're right. And I think I'll get to you in a second, Benjamin. Thank you. So many of these schools don't understand that we are a political class and that we are exempt from those DEA laws. And even our students don't know that. I didn't learn that until later in life as a student. And so we don't know to advocate for ourselves. Our students don't always know to advocate for themselves in that same way. And so some of those programs I know at the U here, at least one program started to shut down for natives based on their lack of knowledge that they didn't need to. So thank you for that comment. Benjamin, were you going to say something?
Yeah, so I grew up in Minnesota, pretty solid education system. Coming down to Arizona, seeing, they're ranked 51st, but just with respect to those laws and regulations that are passed by the state that might not necessarily have to be abided by charter schools. Um, I know, I know you're talking about like workforce development, so I'm updating a plan with our tribe, or with the tribe down here right now. And, we can't, if we don't have any K through 12 graduates, then we have nowhere to go after that. So that's just why I was bringing up the education. But yeah, it's a vital piece. And seeing charter schools is that plug in now, and it's happening everywhere here where you have a public education school system, and I think it's just one or two schools that are doing good. The rest of them, it's like up for grabs. And at that point, it's if you have the money and the resources, and your kids can go where they can, realize their dreams. But if not, then there aren't pathways.
That's absolutely right. Siphoning funds off from the public system to go to these charter schools that are supposedly public, but oftentimes are dependent on parents to help run the schools. So there's a completely different system within them. Laura, did you have something else to add?
Yeah, this TEDNA group, which is not that well known, I don't know if you've heard about it. It's the Association of all the tribal health departments in the country. I put it in the chat, and they just did a testimony to the Appropriations Committee, and I did offer assistance from AIP and IHEART if they needed any backup on their testimonies and appropriations, because it's covering exactly what you guys are talking about. So who do you want me to forward this email to?
Me,
Mary.
I'll take it. Yeah. Another factor, someone mentioned the tribal colleges themselves have had a major hit to their funding. I mean, so much so that the wife of one of the billionaires, ex-wife of one of the billionaires, jumped in to offer help with funding. So, it's ridiculous. I don't know how many people know that Title V, which is it Title V? I always get these mixed up, which is the home of our Indian education, was transferred out of the Department of Education to Department of the Interior. People who don't, what's that, Amanda?
I didn't know that.
Yeah, people, and how much does the Department of Interior, the Department of Education had been working with Title V for how many years? I thought it was Title VI. I keep getting them mixed up.
I think it was Title VI, but
Title
that
VI,
is a huge institutional change for that.
Yeah, that impacts our Native kids. And then on a local level, I know here, ISD 709, which is in Duluth, Minnesota, our APAC, there are federal laws that govern the involvement of parents and families, American Indian parents and families, in local education wherever there are at least 100 students in the school district. And yet so many school districts we're hearing around the state of Minnesota, and I'm guessing that we are not unique, the school districts are not adhering to those federal laws, federal and state laws. So we're dealing with that as well, and that impact on our students. Okay, anything that we're missing on the problems of from policy? And obviously there's the historical policy of boarding schools, and we could go on, but I was thinking more recent. Go ahead, Kathy.
I just wanted to address the comment that was made earlier. Sometimes changing the title, because, for example, I've gotten NASA grants for reservations, different programs, and their STEM pipeline funding dried up. We had to take anything, even girls were considered DEI, so I had to take that out. But then they got rid of the funding. But some of the programs that have survived are that term workforce development. So there may be ways of when this is written up to phrase it in a way that is more like, well, you need more people out there to do whatever needs to be done. So rather than improving anything that, even if it technically isn't DEI, but it's interpreted as DEI, it may be helpful to frame it in growing the workforce for the country in general. You know, we're trying to do immigration issues and who's going to pick up, you know, we need to do workforce development. In other words, that's a key term, and that's how NASA saved a few programs, just to throw it out there.
Yeah, well, that's how iHeart exists. So I heard. Yep, thank you. I want to make the comment about from Laura. Thank you for that. Your child on an IEP, and how as school districts get less and less money, all of our programming to support our students, particularly those most vulnerable, and including classroom sizes, right, for these for our kids, are getting crunched. So really good point. Our school district here, and I know that this is not unique, is for the second year of a row taking a huge cut. We had 5 million cut from our school district last year, and we're getting another 4 million cut this year. Ever since I did some work on this a few years ago for a talk I was giving, and ever since 2008 with the last recession, schools got hit heavily during that time. And while other sectors of our government, other industries started to rise back up from that hit from 2008 recession, school districts have not. So our funding has continued to either be stable or decrease. And decrease, all of them have decreased relative to others going up. So we've never recaptured that funding, and I don't hear a national call on this, and it's probably because we're being hit with so many other things right now. But this is devastating for our community. If our kids don't start to improve in their schools, again, we can't get our feet under us. We can't recover. And I know we don't like to talk in those terms. We want to be, we do have great strengths, but we can't maintain those strengths if we can't keep our kids coming through this education system so that they're the ones who are calling the shots. More representation to call these shots. Yes, I agree. Lack of broadband infrastructure hurts our students as well in our rural areas. Absolutely. So I want to go now on to the problem or the solutions. Sarah, can you pop those in there, please? Thank you. Here are just some of the solutions that I have on here. Increasing support for American Indian Alaska Native students. That's a little vague, so we're going to have to be more specific there. Halt attacks on the Department of Education. You know, a rising tide, that whole statement, a rising tide lifts everyone. So this is not just about our kids, this assault on Department of Education. This affects all of our kids together. And so it's another way for us to bring others into this fight with us. So we can share this with others. Reverse the transfer of the Title V, it is Title VI, Indian Education from Department of Education, Department of Interior, increase critical funding for Indian education and Title VI, programs. I think I think I have Title V because it's our healthcare, Jason. It's yeah. Increase funding for safety programs like Check and Connect, and then funding for student support counselors in high school and college. Other ideas that you want to throw in, and we can just keep adding to these solutions. Go ahead, Jason.
This is a little bit meta, but addressing the IHS vacancy rate, if we have more native docs in these clinics, they would serve as mentors for these folks.
Yeah, upper mentorship.
So there's a couple things that IHS could potentially do. The main thing is reworking their loan repayment program. Currently, IHS loan repayment scholars are taxed on that money.
Yeah.
If they weren't taxed, if the IHS wasn't taxed, they could open up more of those scholarships. The other thing is payback reform.
Wait. The IHS
sorry.
pays that tax then?
Yeah, and it's
it's
unlike
not the
National Health
students.
Service Score. Yeah,
Oh.
IHS pays a tax, and if they didn't have to pay that, if they were tax exempt, they could. And I have I can send you this, Mary. Some data where if they were tax exempt, they can open up 200 more loan repayment slots.
Wow.
So the other thing that they could potentially do is adjust the payback scheme. Currently, you have to be a full-time
Yeah,
physician. If they went half-time, of course, more women would
right.
consider that. So there's some loan repayment things that we can that y'all can talk about to get at the decrease in the vacancy rate in IHS.
Yeah. Thank you, Jason.
Yeah.
Julie.
Something along the lines of like free remote tutoring. If we can make that available to students of like any grade level, but particularly if whatever they're struggling in, whatever subject that is, I bet there's one of us that would be happy to make that easier for them. And I think that something that can be done, that's something that could be done remotely. So no matter where the person that might want to help tutor the student is compared to the student themselves, that could be a free resource that might make a huge difference.
Thanks, Julie. I want us to think about, absolutely agree, and that might be on a list of things that organizations can provide. I don't want it to be things that we provide. This is a policy paper, so we need to have them help them change their ideas. And that's a great specific example, though, of something that they could do. Thank you. And then Brianna, absolutely. This is my pet peeve. The social determinants of health are the same social determinants of education. Kids can't do well if their parents don't have adequate access to housing, jobs, food on the table. People talk about, oh, if only their parents supported them more. Well, their parents are working their asses off. They can't. They're exhausted. So
the other thing, Mary, the new term, because 5 years in a doctorate of public health program, and it was never mentioned. And I came across a book at UNR Medical Library on the political determinants of health.
Yeah, absolutely.
And I really think that is a major obstacle for Native communities, the political determinants and the social determinants. So the next APHA conference, I'm going to do a presentation on that, because I don't believe that's highlighted enough in our communities, which does include lack of representation and all the things you're talking about right now. Anyways, political determinants of health.
Yeah, a lot of us call them the same, but yeah.
So they are different, though, according to this book. So
okay,
I'll forward you the book title.
Laura.
Yeah, I was going to say one thing is our history and like what a lot of times it's like we're silenced, and though this isn't directly related to funding, but like some type of policy. I did this for a class assignment, but a federal policy to where it's required at least through K through 12 to have that the history, the lived experiences, the history, because that would directly impact mental health and well-being immediately, but also as hopefully that would impact a little bit of society and how we're treated. That would raise confidence. That would to me, being able to get that knowledge out there, that we've done things that we don't get credited for, through history and everything like that. And again, it goes with education, and that could be like a ripple effect. So I'm going to continue to champion to be like, we need to have that instead of just that westernized, colonized ways of like how how America came to be and that type of thing. Because again, I think like our children feel forgotten and left out. And so I think that greatly impacts their confidence in being able to seek out education.
Yeah, that's an excellent point, Laura, that we will definitely include on this. Our solutions is adequate telling of our story. And not just historical, but current as well. Too often we're relegated to the old stories. Go ahead, Gerald.
I just wanted to go back to Jason's comment on taxable for the loan repayment.
Yeah.
Is that in the Federal Register that says that it's supposed to be taxable? Have you looked at that, or?
I don't have the specific case law in front of me right now, but But
for the long-term problem.
what I know is these service sort of oriented scholarships. The IHS loan repayment is unique in that IHS is taxed.
Ha, because that seems to me, I mean, we do the federal state program and receive that. And because we're part of that, we can do non-taxable with our program. And to me, that
It would make
get a couple of
sense.
legislators who are interested in loan repayment right now, especially for rural, because they're putting $50 billion into rural healthcare right now. That
Yeah.
would be a fix that I think would be some, if we could get
Yeah. Yeah,
senators and
we just
congressmen, would
yeah,
be a low-hanging fruit.
yeah, we just talked to so I was doing some of this advocacy through the American Academy of Pediatrics, 'cause that also affects pediatric health. And yeah, we talked to Mark Wade Mullins' office and a couple other my senator, Senator Patty Murray.
Well, let us
So
know.
they're aware of the issue.
Yeah. Well, if you get any traction there, let us know because we can surely, I know that our two senators for sure would get involved in that. So
Yeah, thank you.
in Nevada. All right.
Yeah, thanks for bringing it up, Jason. It was something we've all been working on with IHS every time they come to AAIP for the past 10 years at least. And I know NIHB and NCAI have taken this on in the past. Maine might be a good place to look at far as policy teaching Native history. They passed the Wabanaki studies. Yeah, I think a lot of schools have that, have those laws, or a few, I should say. I know Wisconsin does. Some states are doing better than others. So thank you for that. And that's a good reminder. We could always make a list as well of the states and how they did it. Other ideas on solutions?
This isn't so much from the broader policy way, but as a solution. You mentioned IHS having less folks. One of the things that I've been interested in is, could we set up a training program within IHS to basically teach some of the providers to be mentors while they're in there seeing in a busy clinic, seeing patients and doing that. Not everybody has a natural warm fuzziness, but there are ways of being able to encourage the young folks and even the older ones to pursue a health career. And there may be a way of setting up a program to train the providers in how to do that. The other thing that I have a personal concern, because I get recruited regularly for IHS, just to tell everybody, because we're healthcare providers and interested in this, a project came out, a research study, meta-analysis basically of the world out of Quebec. And it said, it's called healthcare provider denial. So many of the healthcare providers are pretending that respiratory illnesses, including COVID and whatnot, aren't mattering enough. So they're not wearing masks. They're seeing patients. I've seen even cases where pulmonologists are going in between patients with lung infection. This may seem minor, but it's projected, and this isn't someone in their basement. This came out of a major research organization in Canada. 40% are going to end up with long-term COVID. So maybe, and with fatigue levels so bad they can't see patients, they can't take care of themselves. Maybe we could reinstitute a safer environment for healthcare providers to go back into. I don't have that study right in front of me, but if I find it, I'll put it there. But that's something to consider too, to make the environments so that we aren't losing some of the active healthcare providers and we're protecting some of the future ones. And that would be policies that require people to do public health,
Okay.
Yep, stop.
Thanks, Kathy. I really want us to focus on, again, these are federal policies that are affecting the education of our students. So I really want us to think about, how do we address, what statements can we make that we can give to our legislators, our tribal leaders. These are some of the solutions that we see as educators, as healthcare workers, in improving the students' ability to succeed in academia, or in K through 12, through the academic settings in higher education. We are close to, oh, go ahead, Kevin.
Thank you for allowing me to be here. I was on another meeting, my apologies. I was listening to Dr. Greg Kahete, give a talk on education. He's
Good.
pretty phenomenal. But I think working with Sina here in Albuquerque with Dr. Parker, who's Seneca, she's been with the program, has been very successful in improving Native student success. I have a scholarship at the Native Center, which helps students, pay fees, or if they need money for a ceremony, it's there for students. She recently is going to reformulate and look at a strategic plan for the next 4 years. And I didn't go to the meeting, but she shared some of the notes with me with respect to having a Center for Native American Health, being a health policy institute. And so the two legs that she has to sort of stand on is the recent case of Yazi Martinez lawsuit. And I don't know if you guys are familiar with it, but it was the state of New Mexico finding out that there was inequities when it came to giving out money between native schools and non-native schools. And obviously, you guys probably already know the answer of who got more money. So the lawsuit went forward, and it was proven that that's what had happened. So to rectify it, they went ahead and backed up and looked at, okay, how do we redistribute the funding, and what is it used for, and how do we educate the students, especially like with Wi-Fi. I think I heard somebody brought that up. So I think each of our states has native populations, urban, rural. And I would probably pull up that lawsuit and look at how can you use those wording to prove to the state, show us your inequities, show us your receipts of how did you distribute the money. Because if we find out that there's inequity, we already have a precedent from the state of New Mexico where the native have brought a lawsuit and won, and you need to get this money divvied out properly.
Yeah.
That's one. Two, with the Medicaid funding, looking at traditional healing, that's a law. It's they're going to pay out. So linking those two as precedents, as a leg in of precedent and going forward with solutions, it's sort of like, well, how do we use that facet to improve Native health care, student health care, community health care, with the sovereignty that we have to go forward to start to make our own decisions and improve these facets that we're all concerned with. So, I'll lay it on Dr. Parker. She'll probably have a flood of your emails and say, good luck told us that we should call you. She'll probably freak out, but I imagine it's just more support, because we as natives need to share that information. We can't hoard it. We can't be like a university and say, well, in my department, or, did you get accepted to our program? No, well, we'll try to get you back, and how can we offer you? It's sort of like, it's that conquer and divide BS, which is crazy mentality. We're natives, we're tribal. We need to work together. And any law that affects native tribe affects all of us.
Absolutely.
So that's where I see some of the solutions as one leg of what we're all talking about.
Okay, I'm going to make one comment, then we'll go to Jason, and then I think we need to close it out because we have the fabulous Lacey is coming on.
We can go to 3:15.
Okay, so we have a couple of minutes. Regarding that lawsuit, Duluth, we did look that lawsuit up, and we've been trying to get lawyers together to do something similar in the state of Minnesota, which has been failing our students hugely. And it's we are like the second worst in the country for Native students and Black students. So I think people are aware, but getting lawyers to agree to come on to those lawsuits is a little bit harder than you might think. And but I do appreciate that, and we will look at that case for other things as far as solutions. Regarding the Medicaid, it absolutely is one of the problems that our students are facing, because when SNAPs got affected, even on a short term, it affected the outcomes for our students. We know that. So thanks for reminding me about that piece, and we'll work those into the solutions as well. Kevin, you sound like you need to help me on this paper, so I'll be reaching out to you. Thank you. Go ahead, Jason.
The last thing that I would recommend is increasing funding, research funding for pre-medical students. The HHS did away with the diversity supplement mechanism. And this for those of us who do research, this was a mechanism that we would apply for with our pre-medical students to get them some research experience so they can apply for school. So an actual item would be to renew I'll give you the name of it. It's called the Research Supplements to Promote Diversity
Yeah, I
in
know those.
Health-Related Research. Yeah, just re-upping the diversity supplements. I think that would help too.
Okay, thanks, Jason. All of you, we are at time. I really want to thank you, though, for having helped me flesh this out. There's a lot more clearly that we could have in these arguments. I am looking for people who are willing to work on this paper with me. So if you are interested, please put your name in the chat and we'll collect those. Or you can send your email address to Sarah. Either way works. And thanks, Jason. Yay. We'll get this published and get it off to good places. Kevin, I do want to ask for the name of that person that you saw. Greg, if you can put that in the chat as well for the talk that you went to, the education talk would be fantastic.
Oh, Greg Kahete?
Yeah, for IHEART.
Yeah, his talk was at the U of A.
Okay.
And it was today. It's a part of their series. They have a lot of great talkers, so I have everybody try to follow them and listen to those talks because I think there's wonderful presenters.
Okay. Thank you so much. Thanks again, everybody, for contributing to this. We just thought we'd try it, and Sarah gave me 30 minutes to get it done, and big witch, Sarah.